Great, and I've already enabled that, so you'll be
Okay,
set.
great. Thank you.
You're welcome.
Anything else? Anything else? I am right. I have a part of the presentation that will both introduce us to folks who are unfamiliar with us, and then we can also get into that issue at hand.
Good morning, Kathy. Good morning, everybody. We'll wait a second until everybody gets here. I just had to run over and get some backup. Martha, are you here?
I haven't seen her yet.
She's coming. We spoke this morning.
Okay.
She has some conflicts today. There's been a lot of that this session. It's just a fluke, you know. Okay, so thank you. Sue, did you send us these responses?
I did.
Which I am now looking at.
Yes, ma'am. I'm sorry, I wasn't at home last evening, so I didn't get Adam's email until this morning, so.
Well, I thought I was late, but I wasn't, so I was talking to people before I came to my office, which happens, you know. I didn't open my laptop. Okay. And I also have the questions that came out of some of the subcommittee members too, and I don't know if they were stressed very much, but we can go back to that. Okay. Is Commissioner here?
He is?
Yes, I'm here.
Hi, I can't see anybody this morning. I don't know what's wrong. Would you like to proceed? It's 2 minutes after.
Yes, whenever you're ready. We're ready to
Okay.
proceed if you'd like us to.
Yeah, public health is an exciting field to be in these days.
Always.
Yeah. So
Sorry, go ahead.
what we've been doing is the departments present their responses
Okay.
that came up in the discussions. And I might have another question at the end, but about some other things, but we'll see how we go. Okay.
Sounds good.
Okay.
Miriam, can you make the responses fit the width of the screen? That would be helpful. Okay, so thank you for the opportunity to present our responses to you today. What I'll plan to do is go through each question that you posed, and if you have any follow-up questions to each question, let me know at the end of that question. So the first area of questioning was around reductions of district and local health grants. So the first was, what was the reason to reduce the local health district grant funding? When the governor's budget was being developed, decisions were made to adjust for what the budgetary needs were. And so the decision was made to return to funding levels that were at the pre-COVID level. And these local health grant funds would be at roughly 90% of where they are currently, but consistent with where they were prior to COVID. Any other questions on that?
I'm looking at the size of your responses here. Would it be okay if we only have an hour? Would it be all right with the members if we reserved our questions for the end? What is your pleasure?
Works for me. It's up to you.
Well, I'm just concerned that we may not get through all the answers, although of course we can read them.
Okay.
Senator Marks, Representative Kennedy, do you have any preference?
Are they even here? I'm looking at the,
I'm here.
okay. I didn't,
Yeah, I just got on. I had another 9:30 meeting. I'm sorry.
No,
that's
I'm
fine.
here and I actually have a lot of questions regarding the local. but,
yes.
I can,
we can
okay,
wait. I'm
we
okay.
can wait.
well, it's the pleasure of the group. Do you want to hold questions till after after we go through all the?
Would you like me, maybe if I can suggest something, is to go through each bolded area? So, because there's like 4 questions or responses regarding local health and then answer questions regarding local health.
Yeah,
Would
this
that
was
make
one
sense?
of my biggest concerns, Commissioner. So, the local health district. So that I would love that. I don't know if anybody else would. I am going to turn off my camera too, because I'm tired.
I don't know if we can cover everything today, but I can say pretty confidently that there's very high interest in the local health district cut
Yes.
among our members, and it's bipartisan. But there's an interest in gun violence too. I mean, you know, it's not, but definitely, well, yes, why don't you go through the points?
Okay,
And-
so I'll just reiterate, you know, that these were the decisions that were made, and that the question was about the potential impact with the proposed 10%. So our local health departments and districts that are eligible are those that have either a population of 50,000 people in a local health department or a district consisting of at least 3 towns. And of the 59 local health departments and districts that we have, 36 are eligible for per capita funding. Most of our health departments use per capita to support personnel, which translates to 79 full-time positions currently funded through the per capita grant. And these would need to be translated and addressed by each local health department individually. In terms of the exchange that goes on between PH and local health departments on a regular basis, I would like to clarify here that there are 2 major buckets in terms of where exchange occurs. The first is in regards to technical assistance, and this is on any number of public health activities, not limited to infectious disease programming, such as our immunizations program, where we collaborate on disease outbreaks, our environmental health and drinking water program, where we assist on private wells for drinking water or septic systems, or other programming such as food safety inspections through the Model Food Code. So Model Food Code is implemented by local health departments in local area restaurants, but we provide a lot of the technical assistance around that.
Mhm.
A lot of the work that DPH does in terms of regulatory or design is implemented at the local health level, but this is how we work together. That's one major area. The second is as a pass-through on funding, and that then local health departments get from us. One is per capita, as already discussed. The second is usually federal grants that we receive. So for example, We have an immunization grant through the CDC that local health departments have contracts with us for. The second, as an example, is a public health infrastructure grant, or FIG, we call that for short, which is all around workforce development. This was a large grant that was passed by Congress towards the end of COVID, and 40% of that grant was directly sent to local health departments, where they use it as they see fit to enhance their workforce. So this is a second grant that would not be touched by the per capita cut, but so the immunization grant, the workforce development grant, there's a public health preparedness grant that goes out. And so we provide assistance in getting that funding out to local health departments. I meet with the CADH, a Connecticut Association of Directors of Health, on a biweekly basis. We troubleshoot ongoing issues that local health departments may have and projects, and it's an opportunity to discuss any challenges that the department may be facing, that local health departments are facing, and where we can collaborate together. So that's the summary of our interactions with local health departments. I can take questions on that topic.
I have a question that is a little bit on the immunization grant. Do you have all of that in hand?
Currently, we do.
A number of things have happened since we met with your committee, with your department 2 weeks ago. And one of them is that the vaccine advisory panel did not meet in Washington. And there's a lot of anxiety about that, given the timing and also the history of the Commissioner of Health and Human Services. And I was advised by a friend, and I don't really know, but it's an interesting, that we should be thinking about how we would prepare if there is no flu vaccine next year. And the reason being, that obviously since the virus mutates, you need an advisory group to meet and to put together a suggestion of what strains they see out there. I don't know what's going to happen, but obviously people did prevention before there were vaccines. The discussion in Connecticut has always had been whether or not you want to get an exemption. It wasn't about whether or not we should end the program. But if the disbanding of the cancellation of the vaccine panel means that, do you have the ability or could we do some kind of a prevention plan certainly for congregate facilities?
So there are two issues in what you brought up. One was the postponement or canceling of the ACIP meeting, which is the panel that determines the schedule of recommended vaccines. We don't know yet if that will be rescheduled. We wait to see what's going to happen with that. That is run through the CDC. The next one that you referenced was the VRBAC meeting, which was canceled. And that is the meeting that determines which strains of flu will be in next season's flu vaccine. The reason this is important is because it takes a long time to manufacture flu vaccines, and it needs to be identified in advance. I would suspect that the pharmaceutical industries have a vested interest in making sure that their flu vaccine makes it out there. And I would suspect that Secretary Kennedy and the administration at some point, if not from the public and others, will hear from the pharmaceutical industry how this is a decision they need in short order. Now, usually this is a decision that is, done through the FDA, through this VRBAC committee that is, brought together by the FDA. Are there other potential ways that the experts in that committee could meet and advise pharmaceutical companies independent of federal approval? I really don't know for sure, but again, if the pharmaceutical industry is invested in getting their product out there, there may be other ways that a flu shot can make it to market that would best represent what the circulating strains may be. It would be different than what we've done before. But also, I don't think we know yet that that committee is not going to meet. That committee may meet. It didn't meet on schedule, but it may be that it is going to be rescheduled. So we have to wait and see and take things as we go. We as an individual state health department do not have the, I think, vast authority that pharmaceutical companies would want in terms of what should go into that particular vaccine. However, we have experts throughout our state and throughout the country who could do that for the flu shot. So I think they're two separate issues. I also think we do have experts in the state of Connecticut who we could tap and through other federal organizations, should the ACIP meeting cancellation become more of a prolonged or sustained cancellation. And those are the types of, planning discussions we're having on a federal basis, on a regular basis with other state partners and colleagues, and continue to evaluate every day. Quite frankly, this landscape changes every single day, and what is canceled is rescheduled and so we continue to evaluate on a daily basis.
Okay. Yeah, I don't have an opinion. And I know that there were 2 meetings canceled, that I see a lot of alarm from people that I know in other states, and in a virologist actually. And so but I don't know. I think they're worried about the time frame and whether it's doable. So I'll just leave that there. I have no, there have been a lot of personnel changes on the federal level. So whatever their intent is, there may be someone who simply doesn't know
Right.
the schedule. I mean, I don't really think it would be productive to get into hysteria, but I do like to have a plan. And so, okay, other questions?
If I can just make a comment to that,
Yes.
it's my understanding, in talking to different pharmaceutical companies that are in Connecticut, that they have a vested interest in making sure that there is an appropriate vaccine, and they will be looking to, I guess it starts all over the world. So they said about summertime, they're looking to see what vaccine they're going to be able to create for the next year. And they have cautioned that, Secretary Kennedy may have canceled, or these meetings may have been canceled. He has not said he's anti-flu vaccine. He just thinks it should be somebody's choice to get that. So I just want to make that clear. And also, there's a lot of moving parts, but just because they have canceled 2 meetings does not mean that that's the intent going forward. And, I'm glad of what you said, Rep. Dillon, about we want to have a backup plan, but don't want to create hysteria. So
Right,
I think everybody understands how important the flu vaccine is. So
well, I think it is. So when you have a lot of people who have retired from the departments in question. You have new personnel. There have been a lot of changes that in policy, and some people may be reacting appropriately, and maybe they're overreacting. I don't know. I represent a lot of seniors in congregate facilities, and I want them safe. And so
we have been manufacturing a flu vaccine for decades, and I don't see that ending. So I just wanted to say thank you for having a backup plan, but not creating sort of this hysteria. We need to.
No, we don't have to do that.
So thank you.
Thank you. Any other questions? Okay. Yes, Commissioner.
Okay, then I'm going to move on to the next bucket, which is on federal funding. So the next bucket, first question was if we could provide a breakdown of our federal funding over the past 5 years. You can see the historical charts that have been presented, and you can review at your leisure the document with a lot of details. But as you can see, there was a significant infusion of federal funds related to COVID. And those funds are continuing to come down since that time, as we've spent much of that funding for the COVID response. You can scroll down further and see a further breakdown of that. basically looking at our state line item, which is at the very bottom, followed by the insurance fund, followed by our federal total, and then a small sliver of private, which is really revenue from the Ryan White program, which is around rebates on HIV medications. As we scroll further down, we have federal funds specifically that were related to COVID, and this breaks it down a little bit more in terms of the actual funding that we received related to COVID. So the non-COVID federal funding has been relatively stable. You can see that in FY23 and 24, there was an increase in federal non-COVID spending. Some of that is this workforce development grant that I was mentioning, the FIG grant, where 40% of that money went to local health departments. So that has been an infusion that has really helped our local health departments getting that funding from the federal government, from the CDC.
Mhm.
And as you go further down in terms of federal funds that were COVID funds, you can see again the percentage that was COVID funds versus non-COVID funds. And we do in FY24, we still had 30% that was COVID-related funding, but as you can see, we're going back to our generally our pre-pandemic days in terms of funding.
Commissioner,
Yes.
sorry, my microphone wasn't working. Can you give us an idea of what it is that the federal government is giving us funding for specifically? So I think that information would be good to have. Like, what do they give us funding for?
Okay, so we get 119 federal grants from 17 different federal agencies. It spans many, many things. 71% of it is from the CDC, including things like infectious disease response, immunizations, support of our state public health lab, maternal child health funding, funding to support environmental health and drinking water. This is more from the EPA. EPA funds about 11% of our budget. We have healthcare quality and safety, about roughly $8 million a year, that is related to our inspections of nursing homes, hospitals. Just to keep in context, 75% of our overall federal spending is from the Department of Health and Human Services and Undersecretary Kennedy. The other 25% are from other agencies. Our WIC program, certain additional programs that are additive to the WIC program in terms of benefits that young families receive on food. So that's just some broad strokes of the type of funding, but it's quite vast. As I said, 119 federal grants from 17 different agencies.
Okay. All right, that's very helpful. Thank you very much.
You're welcome.
Representative Nuccio, I wonder if I could ask you or ask the commissioner about your very helpful question. The dollars that you identified, Commissioner, represent positions in our budget that we would have to take a look at, or are they block grants, for example?
So
there are positions included in those federal dollars
So
that we might have to look at.
Right. So we have state funded positions that we presented in our appropriations committee meeting. But then we have positions that are solely funded by federal dollars. And that is approximately 357 FTEs that are funded through federal dollars.
And again, I'm following up on I think Tammy's line of thought, but I don't know what your line of thought is totally, but it was a fruitful question, I think. Do we have a plan for what to do with those positions if those dollars are cut?
That is a lot of the planning that we have been doing. As I said, the landscape changes every day.
Right.
Almost every single one of our grants got a cease work order related to the executive orders initially. The temporary restraining orders allowed for flow of funds again. Now additional changes are being made by HHS to the APA and other procedural rules that they have the authority to change. And so we are continuing to plan how we will address what may come. We don't know what may come, which is why I said right from the beginning that our planning is all across the spectrum,
Right.
from
Stephanie?
no impact to full impact.
Yeah.
And that
Stephanie.
is being, a very fluid situation on a daily basis.
Okay.
I think we're trying to get
Are
to.
you done? Because we have another question, but go
No,
ahead.
just one more. I think we're trying to get to the same thing. So, Giovanni, is there any way you can give us kind of this breakdown in writing? And also, if you could also attach what was initially frozen and then unfrozen. I'd like to understand like the 75% funding, the 25% funding, where it's going, which items were the ones that they said, hey, you're going to have to freeze this. I think that gives us at least a little bit of insight. I'd kind of like to see it broken down. I know the 357 positions, you mentioned that. If we can kind of see by program where the money's coming from, and then, which ones we were initially told to stop on and then were released, I think that would be very helpful.
Yes, I will say that this literally changes every moment of the day.
No, I get that.
So what I want to caution you on is that we basically got a stop order on all grants. Then they were all released because of the temporary restraining order after some back and forth. Now we're getting more targeted messaging. And so every day a different message comes. So whatever we do send you at some point, likely by the time we hit send, it's going to be different. So I just want to caution you on that.
I think the biggest piece then is really just the 75-25. What's the breakdown? Where is it coming from? Is it like you said, you mentioned EPA, you mentioned HHS, you mentioned this, I'd like to understand what falls where, what are the dollar amounts, kind of have that menu there of this is where everything is coming from. So we can kind of track that.
Sounds great. Representative McCarthy-Vahey, I know we've kept you waiting here, but.
I'm happy to wait because I'd like to build on the conversation that Rep. Nuccio and you have been having. I think it's very helpful. And I think Commissioner Giuntani, thank you for being here with us and for your work, and to your whole team who's here. I think that what Rep. Nuccio is talking about and the way you're responding is it's almost like the homelessness count. We're looking for maybe that point in time, recognizing that it is an evolving landscape, and that's part of the struggle is the lack of predictability with what's happening. But just to clarify what you were saying before, I heard you say that 119 federal grants come from 17 agencies in the federal government. And then you told us that 71% come from the CDC, and you also shared a 75% statistic from HHS. So
so to be clear, HHS is the parent organization, right? Within HHS sits CDC. So when I said 75%, I was trying to say that CDC is 71% and an additional 4% is HRSA. And a lot of our maternal child health work, our work on student loan repayment is from HRSA. So 71 plus 4 together, 75% is HHS. That's what I was trying to clarify. Then the other agencies, so that's the 75% from HHS, making up CDC and HRSA. Now for the other 25%, roughly 11% is EPA. And I would have to get back the exact numbers, but let's say roughly another 7 or 8% is USDA, which is where WIC would fall.
Right.
We have 13 agencies that make up roughly 5% of the overall. And so what that pie chart looks like, we can get, some more clarity to you, but that gives you the broad strokes on where we get our biggest funding from.
thank you. That is exactly the clarification that I was looking for is, I know there are a lot of veterans on this subcommittee, but for some of us who are newer, and just the reminder of just how that works. So I do think having the breakdown for us here in the subcommittee would be incredibly helpful, so that we can understand and also make the calculations as we work alongside you with it. Thank you very much, Madam Chair.
Thank you. And I'm assuming the EPA is the Clean Water Act.
Right, so
that has
Clean
to
Water
do
Act
with-
is deep. We are the drinking water group. So the Drinking Water State Revolving Fund, that's DPH. So as I generally say, water into the body, health, DPH, water going out into the environment, that's the Clean Water Act, that's deep. So that's generally where it stands.
Could you do a separate one pager on I do remember, although I wasn't the lead person ever on this, potable water initiative, and that would be you?
Generally speaking, there is some overlap. There are, what I'm saying is the broad strokes. There are some areas where it gets messy, but in the public water systems, in terms of supplying drinking water, that is us.
And it might be helpful in addition to response to Chairman McCarthy-Dahy, if you had a breakout of some of the water issues that your department does. I do remember the testing of wells, but not all of it. So if there's any erosion of function because of changes on the federal level, I think we should know about it. And I don't know what we have the capacity to do yet, because I don't fully know what's going on, but it does change. So
yes, and I would give you just again in broad strokes, there were several things related to the bipartisan infrastructure law were paused. There has been indication that they may want to withhold some of that money, but then the money came through. Then other EPA administrative procedures have now been altered. So it's unclear to us exactly what will stay with us, what will go back. This relates also to lead service lines, to PFAS, to lead in schools and daycares. These are EPA funds that we receive. Again, like I said, this one day I think I have it, the next day we think we don't, the next day we think it again has come through. The next day we get more administrative procedures. So it is a changing situation. And it's hard to know exactly what's going to happen at this point.
good, thank you. And if someone else has their hand up and I'm missing you, oh, Kristen, again. Okay, yeah.
If I may again build on conversation that you're having related to the water issue, we had an interesting meeting with DPH and DEEP the other day related to some of the state changes that we've made. So in terms of any sharing information, it might be helpful for us to also understand the changes there with the water going out, so to speak, as you said. As you said, you're talking broad strokes, but there's been some movement from DEEP to DPH. So I think in the context of this conversation where you have the federal questions, we also have some state changes, and it might be helpful for us to have that full picture together.
Yeah, and if I could add to that, and I don't know if we have a write-up anywhere, but there were some Supreme Court decisions that mean that we wouldn't necessarily look to the federal government for some issues involving water and air. And that was last summer, I believe, in the summer before. So that may be modified, but although I think our own statutes may be stronger on the water side, if I recall, but I really need to look at that. So in addition to that, we may want some kind of an analysis of the state of the law. I don't think we can hide behind the law. I think we have to decide what we want to do, but that's me. Well, thank you. Okay. Were there another question? Otherwise, move on to.
So the next topic is around gun violence prevention.
Pardon me?
The next topic is on gun violence prevention. Shall I continue?
Okay, go ahead.
Okay, so the first question was around the increase in gun violence prevention account. We believe you were referring to the increase of $4,499. This was just to reflect wage increases. And that was the first question. The second was around the Commission on Community Gun Violence Intervention and Prevention. So what I wanted to clarify here, because it did seem like there may have been some confusion on this topic, is that this commission was put together basically to provide DPH and me as the commissioner information on best practices in community gun violence intervention and prevention. And it's an opportunity for organizations and local health departments, hospital providers, police to all connect on the work that they're doing. As it relates to funding, to be absolutely clear, never has anybody who had an opportunity to apply for a grant been involved in the writing or review of an RFA or of the applications that were submitted. So there has been absolutely no overlap between people who are on the commission and those who have actually reviewed an RFA, written part of the RFA, or received an RFA. They received an actual award. So these decisions have been made by an RFA review committee, which over time has gotten smaller and smaller because many people do want to apply for it. But we have brought in other external partners in addition to DPH personnel who've been able to review these grants, particularly people from the community who are involved in this space and working in this space, but not actually applying for those grants. The meeting minutes and agendas can be found on our website, just as the state rules follow. And there's, links to postings where people can find this information. And specifically, you can see the links both for the Violence Intervention Prevention Group and for the Rare Disease Advisory Council. And then specifically in terms of our ARPA funding on gun violence, and then our state general funds that were given on gun violence. So in terms of the ARPA funding, the first RFA that went out on that went to fund 8 community-based organizations that we've listed there. And then the general funds, there was a second grant that went out for that, and that funded an additional 10 community-based organizations. So we have a total of 18 community-based organizations that have been funded through this initiative to date. Any questions on that?
I guess I have a question. This is helpful. I was really kind of focused on the money in your department, and the advisory committee, I think started in the Senate. I don't know. I remember Senator Moore was very emphatic about it. So there was a group of people that did that, but we had enough work to do making sure there was money in the budget. So the advisory committee was really kind of separate from the work that we did in this subcommittee anyway. I don't know, but it's helpful to know that, is that helpful? Are there any further questions on this?
I have a question. I'm not on camera. This is Senator Summers. I'm
Okay.
wondering, Commissioner, do we have any metrics on how this money is being used and what the outcomes are from these individual groups that have received the money that we can use as sort of a measurement tool to see how that money is being allocated and used and what the outcome is? That would be helpful, I think, for this committee.
Yes, we don't have that information yet, but that work is in process. So we also had an RFA for an evaluator. So somebody who's going to be actually evaluating these 18 different groups and generating similar metrics that can be compared across the groups and then following their outcomes. So that evaluator contract is almost signed, and that group will be starting their work shortly to be able to do just that.
Okay, and do we know if all of the money that has been given, or, I don't want to say given, but the opportunities for these 18 different organizations, do we know if they have expended all the money, or can we get a balance sheet on where they are as far as their funding is concerned?
So the Excel spreadsheet that we sent on the ARPA funds gives you some indication for the first tranche of money that was ARPA in terms of what people have spent to date. That was a 2-year award. And so that work is ongoing and people are continuing to do the work and submitting their receipts. So that money has been obligated, it's been contracted, and now it's the groups that are spending that money. For the second set of 10 community-based organizations, it was a shorter contract, less than a year for them to do that work. They also are in the process and will be working on completing their expenditures and submitting those expenses, by the summertime. So that breakdown of the general fund money is not in the Excel spreadsheet, but the Excel spreadsheet does have the ARPA funding.
Okay, thank you. I'll have to go back and take a look. I don't recall I recall vaguely seeing it, but I don't remember if it was really specific as to what, and maybe it was it specific as to what exactly the money had been spent on, or was it just sort of an accounting, we received this is what has been expended to date, etc.?
It was for the ARPA, ARPA Excel spreadsheet. That one in particular is for those first 8 community-based organizations, so not the second tranche of general fund 10. And so when you look at the Excel spreadsheet, you will see that, I'm looking at it right now, seeing if I can point you in a direction. There is the line item on number 31 on community gun violence intervention and prevention. And this was contracted to CCMC, who is working with these organizations and providing technical assistance to help speed the actual conduction of their work and then expenditure of those funds. So it is all 8 together, not broken out by the 8 individual groups. But we can send, the press release that we spent that tells what the work is that each group is doing. And then that's, more detailed expenditure is not in that spreadsheet because it lists what the overall group had spent on block.
Okay. I think, would we be able to get that detailed information, or is that, could we go back and ask them, each one of them specifically, to get more detail, or is that not something that we would be able to get? I think that would be helpful.
So I'll talk with my team. I mean, we get reports in terms of when each of these groups have spent their funding, and we should be able to get that. It may take a little time, but we should be able to get that.
Thank you. That would be great.
And this is not, I don't know if there's any controversy, but the sort of umbrella or the agency of injury prevention, which gun violence is within, also collects data on all kinds of injury, and I believe draws down dollars from the Violence Against Women Act because it has a pretty robust set of data over time about sexual assault. Do you have any new information about that or any of those programs at risk?
I don't have new information. As you mentioned, that is work that the health department does. And as you mentioned, there are many different forms of violence that we monitor and collect data on. This specific group and body of work, because of the investment from the legislature into specifically community gun violence, necessitated the building of an Office of Firearm Injury Prevention, where gun violence was removed slightly. They still collaborate with the greater violence intervention work that happens within DPH. But because of this work and the amount of money that was put towards doing this work, we've elevated that work into an office within the commissioner's office so that we could make sure this money was actually getting out the door and to the community-based organizations on the ground.
No, I do recall that. That was the governor's desire, if I recall. So that's fine. There are other programs in the original department, though, that
they still continue. That work has not stopped.
Preventing sexual assault is just as important,
Absolutely.
Right. Okay, next question.
The next topic was on the Haven program. So one of the things I just wanted to be clear is that Haven is not a DPH run or regulated program. I know there were a lot of questions at the hearing about this. What DPH does related to Haven is we provide funding to Haven through a fee from practitioner licensing fees. So there's roughly a $5 additional fee on practitioner licensing fees that is then given to Haven. Haven, just to provide contextual information, is a confidential assistance program that provides education, prevention, intervention, referral assistance, rehabilitation, and support services to healthcare professionals and pharmacists who could have a chemical dependency, emotional or behavioral disorder, or physical or mental illness. And anybody can be referred to Haven. People can self-refer. People can be referred by a colleague or an employer or a family member. And then the participant enters into a contract with Haven where they outline the terms and conditions of their participation. This could include urine drug testing or other types of testing, participation in therapy, attending anonymous or other group meetings, reports from employers. And each agreement that is set up with a practitioner is dependent on what the reasons for referral may have been. So the work that continues with individual participants is really separate and apart from DPH completely. There's a firewall between what the actual work in terms of rehabilitation is with the given licensee. It's just that we provide this fee to be able to do that. So, you know, how are these fees allocated? 51%, we are told by Haven, of their operating budget is through these licensure fees that DPH collects. And the chart that is included in this document gives you a sense of all the different professions that provide that fee to the fund of Haven that gets transferred to Haven on a regular basis. And those professions that have an X document those professions where a fee elimination has been proposed under the governor's budget. And that is what would be removed in terms of a Haven fee. Second, the question was around compact license information. So there's several compacts over the last several years that the state has entered into. The first is the Interstate Medical Licensure Compact. So all compact member physicians do pay the Connecticut license fee. So even if they're a member of the compact, they still pay the Connecticut license fee. For out-of-state licensees that participate in compacts and allow them to gain Connecticut licensure, the following compact members do not pay a Connecticut license fee already. These include SciPact, which includes psychologists. This covers licensed psychologists only. Then it is the Physical Therapy Compact. This covers physical therapists and physical therapist assistants. Then we have the Nurse Licensure Compact, which pertains to RNs and LPNs only. It does not cover APRNs. Then there's the Social Work Compact, which covers licensed clinical social workers and master's level social workers. And then the Counseling Compact, which only applies to professional counselors. To accommodate for the loss of funding from licensure fees, the governor's proposed budget includes an allocation from the opioid settlement to Haven to account for that loss in funding. And the Opioid Settlement Advisory Committee would have to approve that allocation.
Right.
Commissioner, before you go
Yes.
on to that,
Mhm.
can you, so let me just make sure I get this right. So if somebody in the psychology field joins the compact, right? Is that like a step they have to actually say, I'm joining the compact, and say they have a license in Massachusetts? Now they can apply to practice in Connecticut and will not have to pay the license fee because Connecticut is part of that compact.
That's correct.
Okay, and then you said that, I'm a little lost in that last section there. So the loss from the fees it's saying, it says the allocation from the opioid settlement is going to Haven. So what does that have to do with the compact licensing fees?
So it has nothing to do with the compact licensing fees. What it has to do with is the table above. So
Okay, all
more
right. So it has to
sorry,
do,
that statement should have probably been right under the table because it's more relevant to that.
this
So
is
what this
people who are
means,
applicable to Haven, right?
so what we were trying to explain is in this table, the professions that have an X, the governor's budget proposes an elimination of fee
Okay,
for those providers so that they don't need a fee to get that license.
okay. And
Within
that's-
every
that's
fee,
telehealth and in person, right? Is that? the
and
case?
just to be licensed, as a
Just to be
provider to be licensed, right?
Okay,
So
so we're
in
gonna
every
remove all
license,
of these fees. And then he's going to pay for Haven out of the opioid money to accommodate for the loss of fees. Is that right?
correct. So
Okay, I got it.
right. So only a small portion, only $5 of any license fee goes towards Haven. But by removing the entire licensure fee, they would also lose that Haven component. So the way that is being proposed to offset the loss of the Haven component is to put a proposal before OSAC to do opioid settlement funds to make Haven whole.
Okay,
Okay, Senator Marks.
Thank you, Commissioner. Will you be telling us where the loss of those licensure fees, if only $5 of my $100 nursing license goes to Haven, the other 95, will you be telling us where you're making up for all of that loss?
All of that goes into the general fund. DPH does not receive that. So that's the general fund budget that you all work with the governor's office to create a budget on every year.
Okay, so the only part that you got was the $5?
That's correct.
Well, that's not very fair, is
We
it?
don't get
Okay.
any licensure fees. DPH gets no license fees. It all
Okay.
goes to the general fund.
Thank you. I didn't know that. Much appreciated.
Representative McCarthy Vahey again.
Thank you very much, Madam Chair. I appreciate it. And Senator Marks, it's like when the library finds, don't go back to the library. I will ask just if you could remind us, Commissioner, in terms of those licensure fees, is the removal of that, is it just renewals or is it also the initial licensure for new providers? I've been hearing from some of our healthcare providers, particularly community mental health, that in terms of workforce retention, some of those initial fees are particularly onerous for people, especially as they're coming out of school. So I just wanted to clarify that.
So it is only for the renewal fees.
Okay, thank you very much for clarifying. Thanks, Madam Chair.
Well, I think it sounds like we're gonna have to unpack this. This little item is caused more chatter. It's amazing to me. People are confused or they're asking why them or why that or how are they connected. But we'll take some time to reflect on it. Thank you very much. And can we move on to the next? We're getting right.
So
close
I
to the end
do
of
want to
the-
provide one point of clarification and we can get back to you on this specifically, just in terms of what is actually in the governor's budget in terms of initial licensure fees. I will have to confirm, it is possible that the governor's budget also has waived initial licensure fee. However, the reason we didn't focus on that is there's no portion that goes to Haven in the initial licensure fee. The Haven $5 component is only on renewals. So in terms of the impact on Haven, it's only on renewals. So I would say just because we don't get the money for any licensure fees anyway. So in terms of our budget, it doesn't change anything. So I would just want to make sure you clarify that because I'm not sure. I'm not 100% sure if initial licensure fees are also being proposed to be waived. So we will have to get back to you on that. But
Well,
definitely Haven is only in renewals.
If you could provide any information you have to the appropriations administrator. And maybe the nonpartisan fiscal staff can poke into it as well. We should really move on, but thank you.
Okay, and I'll just say that if you have any other questions on the type of providers that are serviced by Haven, we've provided that breakdown. You can look at that at your leisure. I will go on to lead in the interest of time.
Right. So what we have left is lead and AIDS.
Student loan repayment program.
Okay, go ahead.
Okay, so lead, we have obligated the entire sum of money in terms of ARPA lead that was allocated to us. You can see the amount that has been spent to date. We have 451 total cases of lead remediation that have been investigated by our local health departments. And then there are 248 units that are actively being remediated, another 123 that are scheduled to begin remediation. This is where the additional spend down will occur, and another 105 applications that are currently under review.
Okay.
Okay, so moving on to our student loan repayment program. As a reminder, there were two sources of funding for the student loan repayment program. One was ARPA funding that we received, and the second was a grant that we received through HRSA. So as I mentioned, that 4% of federal funding that we get from HRSA, that is on maternal child health and on student loan repayment. We were able to fund a total of 187 people who either received full or part-time grants for a total of over $7 million in this regard. So you can see the various disciplines of people who received either, some form of student loan repayment through this. Any questions on student loan repayment program?
Do you have another, yes, Kristen?
Thank you. I'll try and be quick. This is the same program that we had to make the change in the bill that we just passed out of committee in order to continue.
That's correct.
This program. Okay, thank you for that. And then the Horizons grant, are you guys involved with the administration of that, or who? I'm forgetting.
I'm not familiar with the Horizons grant. Anybody?
Health Horizons is OWS.
Oh, right. Thank you. Thanks for
Oh, yes. Yes, I know what you're talking about.
Health
Sorry.
Horizons.
Yes, that's
Thank you.
OWS. Yeah.
Thank you, Rep. Dillon.
Okay.
Quick question also, did the 7.4 million, there was nothing in our general fund budget, that was through ARPA and the HRSA?
Yeah, right. HRSA,
Okay.
correct.
Are there
That's
any
right.
dollars in our budget from the
No.
government going forward for this?
No.
And what was the total amount that we had?
The total amount that could have been spent on this?
Yeah.
So the pocket of money that we did not spend was related to physicians. So it was roughly 11.6 million total that we were allocated. There had been a specific carve out for physicians. However, we only had a certain number of physicians that actually applied. So you can see in the table between Doctor of Medicine and Doctor of Osteopathic Medicine, there were 17 physicians who received that funding. And then some of the rest was towards administrative costs that went to UConn Health to be able to actually administrate the program.
Okay, so this money goes away, right, at this point?
This is it. This is it. The
This is-
reason we
so-
asked for the language change was that in the future, if we should ever if HRSA runs a student loan repayment program, I don't know if they will do that again. I don't know if that will be something we will be eligible to apply for again, ever. If they do, we wanted the language so that we could restand up this program without any administrative barriers. So that was the reason for the request in bill change language.
Okay, and do you happen to know how much the administrative cost was that went to UConn? Or you can get that for us if you don't.
If we could provide that to you at a later date, that would be helpful.
That'd be perfect, thank you.
Sounds good. Next.
The aid services funds is the next area and last topic for us to discuss. So the overall summary that I would say here is that the reduction in funding that we will be receiving will not have an impact on the types of services that we have carried out to date. So we know that there is always a need for HIV prevention services, whether it be in the setting of testing in the community, whether it be in community assessments, outreach, retention and care, testing for hepatitis C, testing and counseling for sexually transmitted infections, substance use disorder, harm reduction services. There's a litany of programs that we have and that we run RFPs for to be able to have new members come forward to be able to participate. And, healthcare and support services used approximately 1 million in each fiscal year to provide these services to low-income people throughout Connecticut. And then an additional 1 million was used for supplies and other expenses. This includes HIV and Hep C testing kits, syringe exchange, overdose prevention supplies, things like Narcan, condom distribution, other prevention supplies. So all in all, with the work that we are doing to date, we believe that with the current work we have, we will be able to remain full.
Do you have any pass-through money from the federal government that goes to any groups that you're concerned may not be there?
So we have a large sexually transmitted infection grant that is separate and apart from this state funding that helps to support HIV and STI prevention services. And we are awaiting a notice of award that we were to receive on March 1st. Sometimes there are delays in notice of awards, but we are waiting to hear that. To our knowledge, none of our partners around the country have received their grant as of yet. We are waiting to see.
I wonder if you could provide some information on that to our OFA, to Lindsay. Is Lindsay on the call? Yes, and just to chase that a little bit. We don't usually do federal money, but it's a lot more important now. So, in terms of its impact on us, or the lack of. So, great. Are there any questions about that AIDS response? Because we are now hitting 11 o'clock, which means, Commissioner, that you have completed your mission.
I appreciate it. Thank you. I think we did get through all the information and hopefully we're able to answer all your questions.
Okay, thank you very much.
Thank you.
And Chair DDS has joined us.
Good morning, everyone. There are a lot of buttons to click when I got here. Can you hear me okay?
Good morning, Commissioner.
Good morning. That means you can hear me. I think my team is present today. Jill is with me by my side, not on camera, but is present as well. And I think, oh, and there's Kevin. So I think we're fully assembled, Representative Dillon, whenever you're ready.
Okay, and if you have your responses to the questions, what we've been doing is asking the commissioners to present. So that is the first. And the second is that Senator Marks has a conflict and will have to leave before the meeting ends, so that if she has any questions about any of your responses, I would suggest that we defer to her as the Senate co-chair. We've all been in that situation. Okay.
Thank you, Representative Dillon, and certainly Senator Marks has questions along the way. We'd be happy to do that. And my Chief Operating Officer, Katie Rock-Burns, is driving the slides in front of you today. I'll present.
Could you make them a little bigger? There you go.
Are we good there? We can go bigger if you want. You're okay there?
I don't have prescription glasses on. It's too much information, but there you go. Thank you.
Yeah. Well, thank you again for the questions at the appropriations hearing and for the ability to take some of those questions and report out to you today. with responses to those questions. My understanding is my staff have furnished them in writing to your hearing administrator, Ms. Keene, and we thank her for assistance in doing that. But we'll just get right into the questions if you're ready, Representative Dillon.
Yes, Sam, go ahead.
So thank you. The first question that we noted and confirmed with OFA, how many people does the PCA agreement cover? We responded specific to the DDS enrolled employees on the PCA, our self-determination process, the PCA waiver. This is not reflective of all the PCAs in the state, but as of February 21st, there were 6,258 active PCAs enrolled with our FI for DDS funded services.
Mhm.
Okay. The second question we took that day, how many staff are currently working at Southbury Training School? We have 395 full-time staff and 35 part-time staff working at Southbury Training School. The current census is 97. 3 of those individuals are actively in transition to a group home, a community living arrangement, as we note there, CLA. And the other question that was asked in going back and forth was around how many buildings are on the campus. So there's 120 buildings in total on the campus. 45 of them are still in use or operational. So that they're maintenance buildings or other buildings beyond the living areas for the people living on the campus. The third question.
I have a question on that, if that's okay, Rep. Dillon.
Yes, sir.
Yeah, so I just had some meetings with some constituents and we were looking at, the nonprofit funding and then the STS here, the Southbury Training School. And the budget that you guys have here for 97 people is really high compared to what's happening with people being in group homes and having resources there. So with 395 staff for 97 people, I'm trying to find the logic in that. Like if there's more detail that you can give me that can tell me why I need over 400 staff people to take care of 97 people and the absolute cost of this program overall, I would really appreciate that because I'm really struggling with telling them that we can't give funding for group homes when we've got such a high budget here for the Southbury Training School.
Thank you, Representative Nuccio. We'd be happy to schedule time with you. And there's some other people that we might include in that meeting to discuss just that. As opposed to trying to go through the detail of all that today. It's a pretty large question and not one I could answer off the top of my head with any specificity.
Okay, I'd like to set that up if we can before the decision-making meetings, because I think this is something that, Rep. Dillon, I think we really need to kind of to look at it. Are we doing this the best way that we're doing it to be utilizing the state dollars in the best way?
Sounds good. And if you have that meeting soon, which would have to happen, if there's any material information, perhaps the OFA might be interested in having that as well.
Maybe is there a possibility you think we could set up a subsequent meeting for this committee to review that in depth? I think there's a few people on here that would probably like to get that information and understand it.
I can't commit to that right now just because it's really hard to get people in one place.
Yeah.
But I'm not saying no, but that's a potential. But I wouldn't, that may not be the only path, just because it's hard to, I mean, I'm in 2 places now, sometimes in 3. So I'm very sympathetic.
That's fine. We can just, I can get a listing of people who are texting and that who would like to get together. We can sit down and talk about it.
Sounds good. Or we can circle back and
So what we'll do, Representative Nuccio, is we'll email you, we'll copy the chairs, the co-chairs as well. I want to furnish with you ahead of time a copy of the Messier Settlement Agreement, which is one of the guiding tools we use that you may or may not have seen previously. But we want to make sure you have some documentation. And Jill and Kevin will be in touch about setting that up as quickly as we can. And we can dive into that a little bit.
Sounds great. Okay, we're going down to number 3.
Yes. So I'm not going to read all of these to you. We were asked, I think specifically by you, Representative Nuccio, on a breakdown of changes driving the funding for residential and day services write-up. So Nick had sort of explained it. It was a lot of numbers and a lot of SIDS. And so you have in front of you the breakdown, and we're happy to take any questions. I don't think you want me to read to you. There's 4 sets of these numbers because it's 2 different fiscal years and different SIDS. So we have it in front of you. Happy to take questions. We can also follow up if you want to dive deeper into any of these. But I defer back to you. I believe you were the one who asked, Representative Nuccio, how you'd like us to proceed today.
Yeah, let's just, we can review this and then sit down and look at it. I think you're giving us the information here, so we have to be able to go through and digest it.
Yeah,
Absolutely. My team will be really responsive. I know you have a short period of time between now and some decision making. So we'll if you ask questions by email, we'll answer them as quick as we can.
right.
Thank you.
Yeah, and Senator Marks and I may want to do the same, that I've certainly heard a lot from our members about their concerns about community placement, about availability of employment. There's a number of line items there that people are concerned about. So, and staffing kind of looms over all of it. So,
Yes, it does.
yes. Okay, moving on.
You wanted a breakdown of what's included in the emergency placements line item. I had indicated to you that it's been called that since it was set up a number of years ago, I believe in the Malloy Barnes administration. So there's a number of categories we continue to fund out of that. When we received permission to push away from its original design, it was to help with emergencies in general. So we stood up within public. Each of the 3 regions has an individually and family supports resources team. These team members may provide direct support, skill training, family training, information sharing, crisis support, collaboration with local school districts and agencies, and community development. Our ability to use the funds this way helps keep families from necessarily becoming an emergency and needing more comprehensive placement by being able to help families manage emergencies and emergency situations without requesting a 24-hour, 7-day-a-week kind of placement long-term. We also have emergency transitional housing units. These programs are delivered by our private providers, and they support individuals who are experiencing either housing insecurity for one reason or another, maybe homeless, until their permanent residential program can be developed. So we have a couple of these emergency transitional housing units partnered with private providers, and people move in and move out. Our step up, step down unit was one of the first things we created with this emergency funding with the then secretary. This is a program located in Meriden, relatively central in the state. I'm sorry, in Newington. We support individuals who are in crisis, either avoiding hospitalization, potentially a psychiatric hospitalization, or coming out of a hospitalization without a safe place to return until they become stable beyond the hospital baseline. It's a 6-bed unit currently, and they come both from community-based settings and hospitals, and usually the individuals there need a higher level of clinical care. And then another private partner funding partnership that we do is our clinical response teams. This is mobile outreach, tends to be around appropriate behavioral interventions, and as opposed to continuing to fund things in public, it provides these emergency response teams from a couple of providers statewide that assist us with that. Question number 5. If there's no questions there, a timeline for Commissioner Chef's timeline for the next steps at STS. Katie's still working on, as I indicated, Katie Rock-Burns, my chief of staff, COO, is in the midst of trying to schedule those meetings. There are a number of groups we want at that table. We're hoping within the next month or so to have some scheduled meeting dates. We can share those scheduled meeting dates with you and indicate what parties have responded in the affirmative to engage in those discussions.
Okay.
Do you know if that includes, as you step down, reduction in staff?
I'm sorry, can you say that again?
Do you know if that plan is going to include, like, as the numbers continually drop, we're already below 100, that we're also reducing staff?
We do reduce staff on the campus. We do eliminate cottage usage on the campus on a rolling basis. When we have fewer people served there, we have fewer staff there. We don't refill positions. And we tamp down some of the ancillary services. And we'll dive deeper into that when we meet specifically on Southbury. That some of the costs are sort of fixed in terms of supporting the infrastructure and buildings there. Regardless of the number of people, those numbers don't go down, but the direct staffing complement decreases as our census decreases.
Okay.
And I'm not sure if my deputy made it on the call or not. She is present. Okay. So I may defer on some of these things, but there was a question about a detailed summary on the components of subsidized supportive housing, including how the housing subsidies are funded. This is a unique partnership. We play a very different role in this than we do in developing group homes or in our public services. The Department of Housing provides the housing subsidies through their resources, often through federal rounds of funding. Private providers and private developers reach out as these housing rounds are made available and bid or secure, go through the process of applying for these housing rounds. No more than 25% of the individuals in any of these housing development projects are individuals that we support. We do provide the active direct support in those things, but DDS doesn't incur any housing expense. And I apologize if you're picking up background noise. There's some maintenance going on in my building. And so that is, it's through an MOA. We use the RAP vouchers, and in this really pretty cool partnership. We love to show them off. I know that you're all busy now. We'd be happy to show them off in person anytime you want. Just reach out to Kevin or Jill and we can schedule tours. And we now have a smattering of them across the state. You don't have to travel all the way across the state to see them. We have them in a number of areas throughout the state. And I'm just going to ask Elisa if you know currently the number of, roughly the number of these programs that are online and how many more we have in development.
Good morning. Elisa Velardo, Deputy Commissioner. Yes, Commissioner, we currently have 9 supportive housing developments that are open across the state. We have another 11 that are in development, so approved and in process. And then we have 9 that are pursuing funding and the application is in process. So that is a total of 29, including those open, in development, and pursuing funding.
And those units, by the time they're all completed, will literally support hundreds of individuals that are eligible for supports at the department. Correct, Elisa? It's over 100 now.
That is correct. We have well over 100 people currently in supportive housing, and with the developments that are in place, many more that are planning a move to supportive housing.
Any questions on that?
How does this interact with the not-for-profit, the group homes, the supportive housing with what they're doing?
So the private providers that support these are also typically group home providers, people who support group homes. Our friends, the Farmington Valley, sort of pioneered this with us a number of years ago from an agency called Favar, but they are not the only one engaged. ARC Eastern CT down in New London and along the 395 corridor is involved. And Ableist is involved. We have a number of providers, CRI, I think Key, there's Mark Inc. of Manchester. So all of these have a private provider who also does residential supports in other service delivery types, typically group homes or other independent living settings. Lisa, do you know how many different private providers we have involved?
I could easily tally that. I have the spreadsheet in front of me, but you mentioned most of them. We also have arc of Litchfield County, mid-state. They're in every region of the state. Favor has 3 current supportive housing developments. And the remaining developments, I think there are 6 different providers.
Okay, how do we decide where they're gonna go?
We don't. The private developer and the private agency. So the developers, there's a rubric that's used to approve these housing developments. Developers, it's on the private development side as opposed to us instigating or initiating, I'm sorry, not instigating, initiating those activities. And they look to provide that housing a lot. And we've done some pretty neat things in terms of penetrating communities where there's not a lot of Section 8 available or other housing subsidies available. So they're not, and then other factors in that rubric that are not guarantees but are scored are access to employment, access to public transportation, the community safety. I mean, there's a number of things that factor into the rubric by which housing scores these, and some of that's tied to language that comes from the federal funding rounds. So it's not always the same rubric. Sometimes the federal funding rounds that Department of Housing gets may have a specific ask in them to target a specific area or to target a specific community. But in each of them, we ensure that there's a cap of 25% participation from our members, and the other 75% of those units are made available to the community at large based on whatever the housing things are. But their specific locations aren't determined by DDS.
Okay.
We are asked for a letter of commitment when the proposal is approved, if the department will support development for this in that particular area. To date, we've had no reason to say no to any of the approved developments.
Okay, thank you very much.
You're very welcome.
Okay, next question. Thank you.
So I'm going to get some help here as well, but there's some pretty big numbers in this. This was with, I had mentioned the 65 plus caregivers. So I'm going to read the answer. I have some help available as we dig into this, but DDS has offered residential supports to individuals with caregivers age 65 or older since fiscal year 23. A reminder that new individuals have been added to the waiting list each year as caregivers age into that eligibility. But 571 individuals eligible for the department with caregivers age 65 plus have received residential supports from FY23 to present. And there are 129 individuals with caregivers age 65 plus who've been allocated funding. So they have an authorized amount of funding they can use and are currently waiting for specific placements or supports this fiscal year. When I saw the number, I couldn't believe it was that high, but I'm really thrilled. As for reference sake, we used to average just a little more than 100 emergency placements a year. We're still attempting to place all of our emergencies while still being able to target this as not having to declare someone in an emergency situation simply by the fact that their caregiver has now reached 65. If there's no questions there, Representative Dillon, I believe this was your question, looking for community placements by town. We have all the towns listed and the town code name that we use, and then the total number of individuals supported residentially in that town. And it scrolls on for, as you would imagine, 170 so towns. Whatever the number is, I think it's 169. Katie, can you scroll through the bottom just so they can see the next couple pages in case they haven't had a chance to review the documentation we gave to Sue? So you'll have it all in there, and I believe that Ms. Keene has copies of that as well as likely OFA at this point. And those were all the questions we had from that day. I'm happy to answer questions regarding any of those responses or anything in addition you may look to hear about. And you had mentioned when Senator Marks had to leave early. I don't know if you want Representative Dillon to have her go first if she has any. I don't see Representative Dillon on screen. Ms. Keene, is she still present?
Holy Moses, I don't know where she disappeared to.
Yeah, she's not there.
Hey, Commissioner, it's Martha. I'm good. I'm listening.
Oh, great.
I'm still on.
Um,
I don't have any questions.
well, with Representative Dillon's absence, is there anything, I think you're co-chaired, is there anything else in terms of facilitating the balance of our time with you today? I don't want to short you. 23 minutes would be record time for me to escape this meeting. There are no other questions. I encourage any of you who have follow-up questions to go ahead and send them our way. My team is small but mighty in terms of being able to respond to you in a timely manner. I know that we had heard Representative Dillon may have a question, but we can communicate the response to that to her directly.
Commissioner, it's Martha. I do have one question. Can you just send us just a list of where those supportive housing, just what communities each one is in, and the ones that are in the works where they're in? I just want to make sure it's all equally divided throughout the state.
Yeah, Senator Marks Elisa has that list in front of her. We'll get that over quickly.
Okay, much appreciated. Thank
Madam
you.
Administrator, I'm sorry, I didn't raise my hand. This is Representative Kennedy. Commissioner, I just wanted to thank you and tell you that the housing in Orange, the town of Orange, is just flourishing. You were there for the opening, and it's they're doing remarkable there. And I encourage Senator Marks, if you're ever in the area of the town of Orange, that facility is just amazing. And to see these individuals have their independence in that facility, it's just truly remarkable. And I just wanted to say thank you and acknowledge it's not the area I represent, but it's still the town of Orange. So I appreciate everything that DDS was there to support with it. So thank you.
Thank you. One of the fun parts of those developments for us is that they're all unique. Where they're located, how they look, and the communities that build around them. When I was at the Orange one, individuals we don't support had come out of their units to tell me how great it was, how safe they felt with the constant staffing presence on site. It was a single mom with 2 kids in one instance. It was a veteran in another instance who come out to say, wow, these are great. And then to hear that from you, Representative Kennedy, and to be able to provide affordable, sustainable housing in communities like Orange. As the governor said, anyone who's a Connecticut citizen should be able to live in whatever town they want to live in. And these housing developments have allowed individuals who might have had to be placed beyond their mom and dad's home area to be close by in communities that typically we can't afford to be in when we're just using our typical rental subsidy programs.
Thank you, Commissioner. Thank you, Madam Chair.
Representative Dillon has rejoined us.
Yes, my battery died. So, well, not my battery, but although that's a question. Thank you. Yes, the machine went on strike. So you can continue. Thank you for your courtesy.
Absolutely. Representative Dillon, I finished the questions we were originally asked and have taken a couple questions, one from Senator Marks, who was covering for you while you got charged, and one from Rep. Kennedy, and a little follow-up for Rep. Nuccio. But I didn't know if you had any additional questions for me or anyone else on the call today.
Well, I am concerned. I'm looking a lot at the federal changes. And how many people in your system are on SSDI?
I don't know that number off the top of my head, but Krista Ostaszewski, who many of you are familiar with, she is in charge of my Medicaid Ops unit. And I'm wondering if, Krista, you can talk a little bit about our involvement with the federal government with regards to benefits.
Yeah, absolutely. Thank you, Commissioner. Hi, everyone. My name is Krista Ostaszewski. I'm the Health Management Administrator at DDS. I oversee the DDS waivers. Representative Dillon, thank you for the question. Specific to Social Security Administration, the department has implemented a new program to assist individuals in our system with applying for and staying active on Social Security, specifically SSI and SSDI. Generally speaking, a good majority of the individuals we support do receive some sort of benefit assistance from Social Security. We do assist with the application process, and we do assist with attempting to make sure people maintain their supports and benefits. We have rolled out a more formal program to assist with that process about a year ago. It has been a little bit of a soft rollout. Our staff were trained and certified to assist in that process, and we've assisted about 75 individuals thus far. The intent of that is really to make sure people are receiving the benefits that they're eligible for. We hope to continue that arrangement. We hope to continue growing that relationship with the Social Security Administration, because we know it is important to ensure that people have the benefits that they are eligible for. I don't know the number off the top of my head in terms of how many individuals we support actually do receive SSI or SSDI, but we can try to put that figure together and get that over to you if it would be helpful.
Oh, I'm really pleased to hear your response, and I know I'm hearing dire statements out of the Social Security Administration that there are going to be mass firings, and that there is a notion that AI is going to replace the state workers, and at the expense of sounding old-fashioned or something, I'm dubious about AI taking on some of this, and I want to see whether we have the capacity to make sure that people are able to stay in touch. There is a map on one of the sites about the wait times by state, and I think Connecticut was about it was long, but not as long as Utah. So, well, if there's anything that we can do to make your work easier and to strengthen that, I am concerned about the fallout of I was thinking specifically of SSDI, where the individuals, depending on what the family support they have, and some of them have a lot and some of them do not, that they'll have the challenge if there's a problem with their benefits, or on the initial application, which would be even worse. So it's really a gift that you're doing what you're doing, and I want to make sure that we're there to strengthen that if the mass firings actually do go through, then many of the vulnerable people that we represent would not have access to food and rent. Am I wrong? It could be a big deal if they're losing their benefits.
Yeah, thank you, Representative Dillon. We have had no direct word on any specific impact for our programs or the other ancillary benefits through Medicaid that our beneficiaries are eligible individuals and how they might be impacted. We have heard all sorts of scenarios, best case and worst case scenarios, things, all sorts of things. We learned a lot heading into the COVID crisis about being prepared for worst case scenarios, because that was pretty bad and we were not as prepared as we might have wanted to be. We took those lessons to heart. Our partnership with DSS, we are modeling some of those scenarios, but we are not panicking about any of those scenarios at present, because while there's a lot that we're all being fed from wherever we get our information, we have nothing concrete that tells us adverse outcomes are at hand for our programs and those we support. At the time that we get official word that we do, depending on the level of that impact, we may be able to mitigate it on our own. We may need a lot of assistance. And if that were to come to pass, I'm sure that both the governor, DSS, DDS would be ready to engage with anybody who would like to help us strengthen the system and ameliorate any potential downside from decisions made at the federal level. We'll prepare for that, but as of yet, we've heard no direct word that that's happening.
Okay, thank you. And I just have to repeat that I'm really grateful that you have the program in place and that Krista is doing what she's doing. I know
We are grateful every day that Krista does what she does.
Okay. Well, I am told repeatedly for the past 2 weeks, there's no plan to cut benefits, but if you're cutting the staff that help to move the system along, it might have the same effect, whether that's your intent or not. And with the vulnerable group, and I live on the west side of New Haven. We have folks from Marrakesh, we have Chapel Haven there, we have folks at Fellowship. Well, when people say, oh, they're going to live in the community, a lot of them live near me. And so I know some of them have more challenges than others. And that they'll need a little bit of an assist if there's a bureaucracy on the other end.
Yeah, no, I appreciate that. And I can tell you, I visited Chapel Haven, and the community there for the individuals with intellectual disability is so welcoming and strong. When I went into a grocery store to pick up a convenience store to pick up a beverage on my way out of my visit there were a couple individuals with intellectual disability. The person behind the register knew them by name, was able to support and assist them with their purchases that day, said they'd see them soon. It's really pretty neat the way that community has evolved to embrace those we support down that way. You're muted, my friend.
Our public hearing, if people stayed through it to the end, and ended with a video of one of my constituents singing, Carl. So,
Carl Medina, yeah.
Yeah. It is very welcoming, and we have Marrakesh as well, and we had at one time Ben Haven. It's been an area that's much more welcoming than some others were to group homes, and Chapel Haven has gone much further than that. But you've got people that are not considered vulnerable because they're not in congregate housing, but they live in apartments on Fountain Street right near there. They're just living on their own, and they too need help. If there's a problem, I mean, they may not need help, but I mean, they may need assistance if there's a problem with their benefits, if there's a snag in the system. And so again, thank you, and thank you for what you do, and maybe we should make sure that if there's any need to expand it, that we do so.
Thank you, Representative Dillon. Thanks to all of you. I appreciate you and your support.
Any other questions?
Hope you all have a good weekend. Thank you for my staff for showing up today, and please follow up with any questions. Rep. Nuccio, I saw your email came in. We'll be responding shortly.
Thank you so much. I appreciate that.
Yep. Take care.
Thank you. And thank you for all your questions today. Tammy, you really, I think, opened the doors and the windows a little bit so that it helps all of us to understand.
Well, I'm always here to help, Rep. Dillon, always here to help. Thank you.
There you go.
Madam Chair, are we all set?
I think we're done.